everyone. Thanks for joining us again for our Quick Takes series with Ed O'Neill. My name is Hilary Kennedy. I'm the Program Director for Medicaid Leadership at NAMD. And we're putting on this series of Quick Take conversations with Ed in partnership with the Center for Healthcare Strategies and funding from the Robert Wood Johnson Foundation. Today's topic will address some of the highlights from a piece that Ed has written focusing on strategy and how we can set a strategic vision in these times of chaos and uncertainty and help lend some coherence to the organization. So with that, I will turn it over to Ed.
Great. Thanks, Hilary. It's good to be with everybody again. The topic today, as Hilary just mentioned, is how do we elevate from the day-to-day response of keeping the doors open, which I'm sure most of you have been engaged and involved in for most of the past 5 months, to longer term thinking about the changes. And I think particularly just in the past couple of weeks, as it's become evident, I believe that the situation that we now confront is likely to continue through the end of the year at the very earliest, and probably linger well into 2021 in terms of how we work, where we work, what resources we have available to us, all of those things. And it calls for a more strategic consideration. A couple of things discussed in the little brief, just to call your attention to. I do think it's important, particularly now, to remember that strategies there's a type of strategy which is intentional, planful. You gather people, you think about the challenges in the environment, you think about what you do, and then given those things, what are the intentional strategies that we need to put in place to go forward. There's also a school of thought about that values emergent strategies, and these strategies come from what's around. What are the immediate challenges? What resources or core competencies, we sometimes say, that you have available to you in your organization. Maybe some things that you're already doing that could be repurposed or repositioned, realigned to meet a challenge from the outside, either an opportunity or a threat that comes in, to use those classic strategic planning words. I want to encourage you to spend equal time with both. I think the formal tends to get its due, though in this particular moment it may be difficult to do all the formal things. But the emergent is where some great opportunities lie for strategies. A couple of examples. We've done this working at a distance, not because it was a strategy, but because we had to. We started doing it right away because there just wasn't a lot of alternative. Now I think there's some advantages and some disadvantages of that, but it's important to incorporate those into strategies or the delivery of healthcare. I've had one or two medical directors in community clinics tell me, look, I've been trying to get telemedicine approved at a significant level for almost a decade, and it happened overnight. Now winnowing through that to decide what's our strategy to position this for the delivery of services. So balancing emergent and intentional strategy is really important. Strategies are also important. You could dice them up in terms of complexity and how much time and where the time horizon is for a strategy, and that's important. In the little piece that'll be available soon, there are 4 buckets that I like. One is scramble, just what do you have to do? And if you want to know what scramble is, that's what you've been doing the last 5 months. You've just been doing what you needed to do. And some of it has now turned into a formal strategy, I suspect. Second bucket is improve. There are things that you've done historically, or maybe some things you're doing now. The working at a distance would be a good example, that you want to stick with, but you need to improve it. And there's always room for that, and there's great strategic advantage from taking something that's already familiar, that you already have people equipped, aligned to do that. You already have technology, but now improving. Then reinventing. This is something that it's just simply not working. So it can't be improved upon. We really need to change this process. And there, I think there are a lot of opportunities to think about how we, particularly around racial justice issues, how do we reinvent how we think about that? It's in the paper every day now. Defund the police really means reinvent the public safety commitment in the country. And so improving on it's probably not going to work, but reinventing it with the right kind of rhetoric and the right kind of delivery is going to be important. And then there's some stuff that's just started over. It's not, we haven't even imagined. I mean, the public safety issue, we've imagined, we've seen places that have done that, but this is really thinking quite differently. And the best thing I can point to in healthcare is, what right now is still so professionally dominated and directed. But how might we think about long-term shifting the responsibility for more and more of healthcare to individual responsibility? A lot of people on both sides of the aisle could agree with that kind of thing, but how do we go about doing that and not building dependency? And then the division of those strategies, if you can keep your scramble strategies to 60% and then divide another 30% between improving and reinventing, and then keep an eye on the future with 5%. If you do more than 10% of the start over, then you probably aren't doing enough day-to-day business to stay in office. So balancing those is one approach to having more sophisticated strategy. So that's my little quick take on that, and I'll turn it back to Hilary.
Great, thanks, Ed. It's nice to hear that there are different buckets of strategies that we can all try to figure out a way to get through during this time, and that 60% of our time should be in scramble, which is where many of us are finding. So that was a little bit validating. I hope everybody enjoyed today's conversation and continues to read the quick take articles that Ed puts out and listen to the rest of these posts as we have them. So thank you again for joining us, and we'll talk to you all soon.